One of the most severe pains that humans experience is trigeminal neuralgia, which relates to intense hemifacial pain that is usually felt on either the right or left side of the patient's face. Typically, this condition does not respond to medication or oral treatments. One of the best methods used for these patients is the radiofrequency procedure of the Gasserian ganglion, which is performed in the operating room under fluoroscopy. Our patient is a 68-year-old woman who has been complaining of right-sided hemifacial pain for 5 years and has been suffering from it. Usually she hasn't responded to medication treatments, and we are trying to treat her today with the radiofrequency method on the Gasserian ganglion. We hope that this treatment will help her. In the first stage, we inject 2 cc of 1% lidocaine for local anesthesia at the entry point where we will be accessing This procedure needs to be done in the operating room and under complete monitoring. As you can see, this method is non-surgical and doesn't require general anesthesia, just local anesthesia, and the patient is fully awake. Now at this stage, we use RF street blend needles with a 5mm active tip for this procedure, and we insert the needle through the path we've anesthetized. So at this stage, we've inserted the needle, and under fluoroscopic guidance with the Weimar fluoroscope, we've entered the foramen ovale in the anterior-posterior view. As you can see in the fluoroscope, our RF needle tip has passed through the space and is now positioned near the ganglion of Gasser, and is now positioned near the ganglion of Gasser. At this stage, we need to confirm our needle position, which is done using fluoroscopic guidance. A good image is in the lateral view, where we've entered the base of the skull and are close to the nerve roots. To see if this position is confirmed, we use a nerve stimulator to identify our location. We check if it's confirmed or not, and we carefully and precisely identify our position, using the nerve stimulator to ensure accuracy and effectively. One of the factors that helps confirm the position is seeing it on fluoroscopy, and another is impedance, which we can observe on our device. With experience and the level of impedance, we can determine what position it is in. At this stage, with the stimulator we create, I want to see if the nerve or root or trigeminal ganglion is being stimulated or not. Let's start. Or if the root or the trigeminal ganglion is being stimulated or not. Let's start. Well, as you can see, the pulse movements are directed towards the lower area, which indicates that the position we've chosen is on the nerve root, the spot where the radiofrequency pulse is being applied is indeed the correct location. and it has been confirmed in the location we've selected. At this stage, we perform the radiofrequency pulse operation based on the parameters we've specified on the device, targeting the nerve root. We hope that the patient will be effectively treated with this method.